Hey, Alicia, thank you for asking me to come speak to your patients. Dr. Drew here. And I understand you guys are working hard, both you, Alicia, staff, and of course the patients themselves. No one works harder than patients suffering with addiction. And it is extra super difficult to recover right now. I understand it. We're all living like addicts. We're all isolating, from our social engagement out of fear of COVID. We need social connection. We need that contact. And man, you need it when you're in recovery and suffering with addiction more than almost any other population. So there are options for you out there these days. I mean, the Zoom meeting is going constantly. So many of my patients have found the Zoom meetings to be much more satisfactory than we kind of expected. And there are some 12-step meetings in the flesh you can go to, and I urge you, if they're available in your region, please do so. Raise your hand, ask for help, get numbers, get a sponsor. People always talk about the evidence-based treatment of addiction. Well, now there is a meta-analysis out of Harvard that shows that mutual aid societies are as efficacious as professionally managed treatment, especially when abstinence is your goal. So there's that. Don't be in a hurry, everybody. Take time. Recovery takes your time. But do start doing that step work and see about maybe some cognitive behavioral therapy or trauma-informed therapies. But again, don't be in a hurry for those things. It's a matter of just getting the addiction under hand first and foremost. And that is a tall enough order. I understand how difficult that is. People in your life may not get it. It's hard. I understand. And hopefully the people in your life will be going to Al-Anon so they can take their stuff, out over there. And of course, some sort of spiritual program is it's sort of an uncanny part of this process, but I've seen it work over and over and over again. So the fundamental sort of advice I would give you if you're struggling right now in a treatment program is run up that white flag, surrender. If you can find yourself surrendering to the treatment team and to the process, things are going to go just fine. If you think you have it all together and you've already completed 12 steps in your first 3 weeks of treatment, that is not a good thing. Just surrender to the process. I know it's scary. I know control is part of the disease, right? As my patients always say, they felt like a piece of crap around which the whole world revolved. That's the fundamental paradox of being an addict. And you feel like everything's going to unravel if you let go. Surrender. And it's especially hard in these times with COVID lurking around out there, I understand. But you can do it. Plenty do. And there's a miracle in recovery. I've seen it. I've seen people thrive, and that's what drew me into the world of treating it, because it was these miracles I have seen, and you can easily be one of them.